Hi, a question I got is about ADD. I treated a lot of it actually. And what's the difference between ADD and ADHD? So ADD, attention deficit disorder, or ADHD, attention deficit hyperactivity disorder. So the H means hyperactivity. So some kids with ADD are hyperactive. They're active, moving. They get into other people's business. They can't sit still. They're constantly, and the teacher tells them, hey, sit down. And so there's the kids with ADD or hyperactive. More often is we call inattentive ADD. So that's the ADD that you basically just kind of spacing out, staring out the window, doodling. Teachers talking, like a wah, 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 wah. You don't really understand, you're just kind of spacing out and tuning out. So that's really probably the more common that I've seen. There's the type of ADD with impulsivity. So some people kind of do things very impulsively without thinking about it, and so that's a subset of ADD. It presents in different ways. How does that affect treatment? In my experience, it doesn't really. The H level there doesn't really make a huge difference with treatment. There's non-stimulants, Strattera, and now the new one called Quare. But the gold standard for ADD treatment is stimulants, and people think that that's terrible. To give the kids, or well, I mean, it's not, number one, but it's there can be challenges. Obviously, the biggest challenge probably with kids is appetite. So we don't want to hurt their appetite too much. So that so sometimes it's just a matter of how to dose things properly. So we don't dose so high where they don't want to eat lunch, they don't want to eat dinner. So we don't want kids. We want kids to have good nutrition. So that's something we got to watch for when we treat it. And usually we start at a low dose and go up gradually until we find the right dose. But typically people might think at first glance, well, gosh, a stimulant for a hyperactive or ADD kid, that's just going to make them more agitated or more. It doesn't actually. If a person, adult or kid, has ADD, actually stimulants they calm the brain down. They actually slow the brain down and calm it down. And you wouldn't expect that because you think like, oh, it's going to get all jacked up. Because no, it's not that way. It actually, and if it's jacking someone up, it's either the wrong diagnosis. We got to relook at the diagnosis, or just the dose is just too high. But the results are amazing, and there's probably nothing more. It's impacting obviously depression, anxiety, bipolar disorder. But as far as quality of life and treating ADD is hugely important. If not, kids struggle. They struggle through. And and it has nothing. ADD has nothing to do with intelligence. It has everything to do with be able to focus, stay on task, organize, be able to just get things done. And I just talked to a patient the other day who's treated, and when I treat an adult for the first time, it's pretty dramatic for them, and they get shocked about. And the guy told me, he said, "I've gotten more done the last week than I have the last 3 months." He said, that's how much of a difference. He said, I'm on. I get things done, And he said, otherwise, but without it, I was just this, and I get distracted, and I have to go back to here, and I just have all this stuff to do, and I can't just sit and focus and you get one thing done at a time. You can only do one thing at a time. And so he said, now I really appreciate that's how most people actually feel or do with it without even taking anything. I go, yeah, it's true. Yeah, but there's a lot of people with ADD that aren't treated, but the ones that are treated are usually very grateful. When you treat a kid, you're saving that kid from years of grief, years of suffering at school, low self-esteem, depression, because I feel stupid, and so it's not stupid. It's ADD. And tip-offs are also if you have difficulty reading. And if you have to difficulty writing, just things that take where you have to stay on task and just getting things done, like I said, and so I treat a lot of it, and sometimes you combine things together. Sometimes I'll combine a stimulant with Wellbutrin, because the Wellbutrin sometimes boosts up the effect of the stimulant, and it helps the motivation, energy part, and depression. So sometimes I'll add things, sometimes like a non-stimulant to a stimulant, and do both together. So I do a lot of combining, but ADD is something that very important to recognize. Unfortunately, out there's a lot of misconception. There's a lot of anti-medication that you shouldn't go. They're putting kids on speed. You might as well just put them on meth. You hear all this nonsense that people say that is ridiculous, but they believe it's true, and you can't convince some people who are that irrational about it. There's just no convincing them. Sometimes it is what it is. You can't. Or they're critical about someone else who takes thing, and they criticize them, and it could be a spouse, it could be a lot of what holds a lot of kids back is their parents. So if kids are struggling and they have ADD and they're diagnosed, and the parents block it and say, we're not putting my kid on medication, no way, or they listen to their friends, or they go online, or they look at Dr. Google, or they get information from bad sources, and then they basically are holding their kids back, and their kids are not going to progress the way they ideally should through school, and that's going to hold them back, and potentially with their career, just their life in general. And ADD medications not only help focus, it helps with communication skills, listening skills, relationships. A lot of things. So anyways, it's a very important condition to treat. So anyways, if you have any thoughts or questions, please, I answer every question that you send to me. So if you have any questions about this or any other video I do, please let me know.